I had the opportunity to present, the results of this highly original study about the use of emicizumab in patients with moderate and mild hemophilia. I need to emphasize that this product is not yet registered for that use in some parts of the world, including Europe. So I think it's important. So clearly, we know that some patients with moderate and mild hemophilia A are candidates for prophylaxis because of their bleeding phenotype, because they have target joints. And we know how challenging sometimes it can be to treat these patients with factor VIII. And the purpose of that study was really to evaluate the safety and the efficacy, as well as the PK of emicizumab prophylaxis in patients with moderate and mild hemophilia A who had no inhibitors. So in total, 73 patients were included, mainly patients with moderate hemophilia A, 21 with mild hemophilia A, and these patients received a classical treatment regimen of emicizumab, 4 weeks of loading, and then they were treated either once a week or once every 4 weeks. And it's important to stress that the population was quite heterogeneous, with a young patient from 2 years of age until 71. There were 3 females in that study. And before the study, 37 of these patients were treated prophylactically, but 35 were treated on demand, episodically. 2 had a past history of inhibitor development, and the mean ABR, model-based ABR prior to the study was 10.1. So these patients clearly had a bleeding phenotype. So in terms of safety, there was no death, no microangiopathy, no adverse events that led to the withdrawal of the drug. And there was a single episode of thrombosis, hemorrhage thrombosis, that was clearly not related to emicizumab. So very reassuring data. Regarding the bleeding phenotype, so clearly these patients had a very good control of their bleeding symptoms while on emicizumab. I don't have time to go into the details, but clearly the ABR was, the median ABR was very close to 0 for all bleeds that were evaluated. And more than 84% of the participants had 0 treated bleeds during the study. Immunogenicity was not an issue. Only 2 patients developed a transient anti-drug antibody that had no impact on the treatment efficacy. Pharmacokinetics was as expected in other indication. And the good news is that while clearly patients reported a significant impact on the treatment burden, so the treatment burden was less with emicizumab. Also, most of the patients clearly expressed preference for emicizumab. There was an improvement in joint score, and the physical activity on treatment was normal. So the patient had no reduced physical activity while they were on treatment. So clearly, I think this is a very positive study. Because it's quite original. We do not have a lot of data regarding prophylaxis in patients with moderate and mild hemophilia. There was a consistent efficacy across all bleeding endpoints. So clearly the drug was efficient. There was a major impact on treatment burden, treatment preference, and also joint health score. I did not emphasize that a significant proportion of these patients had target joints, and for a vast majority of them, there was a resolution of these target joints. So this study, in my view, provides good evidence that emicizumab has a favorable safety profile in patients with non-severe hemophilia who are candidates for prophylaxis. And I think this is the key, the main message of that important study.